Hi there. A healthy brain is able to shift gears all day long. So we have four major brainwave patterns: delta, theta, alpha, and beta. And beta is our fast brainwave pattern, and delta is on the other side of the spectrum. That's our slower brainwave pattern. And a healthy brain is able to shift up and down all day long based on what we're doing. So let's say it's time to focus on something and to concentrate and to process new information. Well, then we're going to be in a beta state. But let's say it's time for us to fall asleep. What do you think we should be in? We should be in the lower state, the delta waves or the theta waves. So what happens sometimes is the brain is not able to shift gears appropriately, and we can get stuck in one specific gear or another. So for example, if we get stuck in a high gear or in a beta state, very often what patients say to me is they have panic, they have worry, they have OCD, they have anxiety, they can't let things go. And if patients get stuck in a lower gear, those are the patients who complain that they have poor memory, that they don't remember where they parked their car when they leave the supermarket, that they can't focus, that they have impulsivity issues. And that's because they're getting stuck in a slower gear, that delta or theta state. There's also an alpha state that is associated with routine activities, almost that autopilot. You know, when you've driven somewhere that you always drive to and you get there and you're like, how did I even get here today? Well, it's important for us to have alpha waves on the right side of our brain, more alpha than the left. And if you have an imbalance in that symmetry, very often that's associated with feelings of sadness, anger, depression, and addiction problems can be linked to this. So my job is you come in, we do a full consultation, an examination, and then we do the QEEG. The QEEG is going to show me how your brain is firing in this moment. If I find that your brain is stuck in this high beta state and you would like support with things like anxiety and panic and worry, the neurofeedback can be an effective modality for you. If you come in and I see that you're stuck in a low gear and you have focus issues, then that's also something I'm going to be able to help you with. So I use the results of the QEEG to determine whether or not I can help you, and then we can do a course of neurofeedback. Neurofeedback is a non-invasive modality that uses your brain to reorganize, and we use technology. You're just simply laying down watching a show, and as you're watching a show, the movie is going bright and dark and you're hearing it and not hearing it so well based on your brainwave patterns. We reward your brain every time you're doing exactly what I wanted to do. So let's say you're stuck in high gear. Every time you lower your brainwave patterns, the movie is bright and you can hear it perfectly well. So your brain is learning what state we want it in. When we do this repetitively, your brain learns to reorganize. And this reorganization can lead to a reduction in your symptoms. It becomes your new normal. For more information, feel free to click the link that says book now, and you can even schedule a 15-minute complimentary consultation where I can discuss your needs.